The latest news, updates, and more from the world of health and medicine. This is Medical Minutes. From Wish TV and Community Health Network, this is a Health Spotlight Town Hall Special.
Good evening, everyone. Thank you for joining us for this Health Special Spotlight. I'm Phil Sanchez. We're proud to partner with Community Health to talk about critical health issues right here in central Indiana. Tonight, for the next half hour, we'll focus our attention on an issue that's impacted a lot of you or your families: cancer. The Community MD Anderson Cancer Center provides cancer experts and state-of-the-art technology all in one place. We start tonight with programs designed to help not only patients, but survivors. And I'd like to welcome in Maci Jones, Vice President and Chief Nursing Executive with Community Health Network. Maci, good to see you. Thank you for joining us. Tell us a little bit more about the navigation program at Community MD Anderson.
Yes, so our navigation program is one of our precious gems within our cancer program here at Community Health Network MD Anderson. It started back in 2014, where our navigators only saw our breast patients, but today we have grown so much and we've expanded those services to cover no matter what cancer type you have. We have a navigator that will accompany the patient and that family member alongside that journey. Each of our navigators are assigned specifically to a disease site, and it's such a special thing because those navigators become very familiar with the disease process. They become very familiar with all of the navigation of care around that specific disease process, and they become familiar with the physicians in those specialty care areas so that they can help bust down those barriers of care. We know that when our patients come to our healthcare organization or any healthcare organization, that it can be quite a maze to navigate. Yeah. And so these navigators are paired with the patient from the point of diagnosis. They travel along that cancer journey with the patient through all of the treatment and throughout that first year post-cancer treatment care.
You know, Maci, I've heard amazing things about the survivorship program at Community MD Anderson as well. Tell us a little bit more about that.
So our survivorship program, we initiated that back in 2017, and it is an extension of our nurse navigation program. And what survivorship is about is creating a quality of life post-cancer diagnosis and treatment. So they will follow that patient along that journey within that first year post-active treatment, and they connect that patient to resources. They make sure that they are staying connected with our cancer team. We integrate primary care into that work as well. And then we also connect them to resources and education and information around surveillance, because there's always that opportunity that that cancer could return. And so we want to make sure that they are on top of their screenings and their follow-up visits. And we also want to make sure, again, they just lead a quality life. So we connect them to all of the many resources that are necessary, such as rehab care or intimacy care, whatever the needs of that patient are, as we just navigate care.
Maci, what programs or activities should interested patients and survivors be on the lookout for?
So I'd like to invite people to visit us on our website at www.ecommunity.com/survivorship. And that will give you access to many of our featured online, virtual, on-demand resources, education tools. We have offerings from gardening to cooking to journaling. Again, we are wanting people to get on with their lives and really put that cancer diagnosis behind them and continue to press forward in a very positive manner. On our website, you will also see an opportunity to register to receive our monthly e-newsletter. And in there, we also provide all of our upcoming events that we would really welcome any cancer survivor to take a part of.
Yeah. Good conversation. Maci Jones, Vice President and Chief Nursing Executive with Community Health Network. Maci, good to see you. Thank you for joining us.
Thank you again.
All Coming up, enhancing cancer care services. Up next, hear about the new stem cell transplant and cellular therapy program at Community Health Network MD Anderson Cancer Center when we return.
The most local news. Wish TV. We are local.
And welcome back to our Health Spotlight special tonight, focusing on cancer diagnosis and treatment. Last November, Community Health Network MD Anderson Cancer Center announced the development of the Stem Cell Transplant and Cellular Therapy Institute. Dr. Sherif Farag is the medical director of the program. He joins us now. For those who don't know, Doc, what is stem cell transplant? And good to have you here.
Thank you. So stem cell transplant simply is just replacing destroyed or diseased marrow with healthy stem cells that can repopulate the marrow. So broadly speaking, there are two types. There's a type where we use the patient's own cells, and certain cancers lend themselves to that, because here what we're trying to do is escalate the dose of chemotherapy to a point to destroy the cancer, but to a point where it would also destroy the patient's marrow. So the stem cells, in this case, replace the patient's marrow. In other situations, other cancers, they don't lend themselves so much to dose escalation, or maybe the stem cells themselves are actually cancerous. So therefore, we use donor stem cells. Okay. And in that situation, when we infuse the stem cells, there are also immune cells of the donor that attack the patient's cancer cells and also wipe out their marrow. So stem cells replace the patient's diseased marrow in that situation. So it's a form of immune therapy.
Okay. I mean, absolutely fascinating. I was doing a little research on this. Tell me a little bit more about the program that you're building over at Community MD Anderson.
So it's a long overdue program for community, but it will really make cancer therapy a comprehensive program. So we intend to do all sorts of transplants, autologous transplants, related, unrelated, matched, mismatched transplants, but we're also going into cellular therapy where we're actually infusing immune cells targeted to the patient's cancer. That's a really hot area at the moment. And hopefully we will also have clinical trials so that we can bring the opportunity for patients to participate or have access to unapproved but very promising agents.
Fingers crossed on that one, right?
Yes.
I know this is a new program, but you have a lot of experience in this, right? Tell us a little bit about your background.
Yeah, so I've been in the field for probably over 30 years, initially in Australia, and then I moved here, and I've had lots of experience with transplant, with research in transplant. I've seen lots of changes over the years. Good changes, exciting changes, and I think there's never been a better time for patients to undergo a stem cell transplant than now.
How does the partnership with MD Anderson benefit a program like this one that we were talking about?
Yeah, I think it helps our program tremendously in many ways, actually, but probably two major ways is that we can draw upon their extensive expertise in developing this new program. But I think even more importantly, we can actually access and discuss with them patients' cases. A patient may be referred to transplant, but that may not be the best option. So by discussing the patient's case in a group, we can actually come up with kind of the best option for the patient without the individual physician's bias. So I think patients coming to community can be assured that they will get the best advice and best options to either proceed with transplant or look at other options.
Dr. Farag, amazing work. Thank you so much for being here. We really appreciate all that you do. Thank you so much for coming on.
Thank you.
Okay. Coming up here on the show, the innovations helping in the diagnosis and treatment of lung cancer when we return.
Wish TV. We are local.
All right, welcome back to our Health Spotlight special. Tonight we're talking with our partners at Community Health about cutting-edge technologies used in cancer diagnoses and treatment. Let's welcome in Dr. Rashid Gupta and Dr. Ashish Pakal, thoracic surgical oncologist with the Community Health Network, MD Anderson Cancer Center. Gentlemen, good to see you. Dr. Gupta, we'll start with you here. Tell us a little bit more about the innovation currently being done in the field of lung diagnostics and surgery.
There's been a lot of innovation in terms of just diagnostic lung imaging. The increase in neoadjuvant treatment and what we specifically do, especially single lung anesthetic events, has greatly increased our ability to resect small nodules, diagnose and resect small nodules that are potentially cancerous, so this way patients don't have to undergo multiple biopsies and awaiting pathology results and then scheduling surgery. So that is one of the biggest advantages that we have.
Yeah. Dr. Pakal?
Yeah, first of all, thanks so much for having us and allowing us to highlight our program. I'll just start by saying that, lung cancer is still the #1 cause of cancer-related death worldwide. And so for us, really creating a efficient, cost-effective way of both diagnosing and treating this disease, that became really important from the get-go. So at Community, we're able to do both of those things, diagnose and treat lung cancer in the operating room all at once under one single procedure. And so the availability of robotic bronchoscopy, which I would liken to a GPS, if you will, for somebody's lungs, that really allows us to find very small lung cancers and remove them before they have a chance to spread. And we're able to do so with minimally invasive robotic lung surgery with very, very tiny incisions, and that really allows our patients to go home within a day or two after surgery. So it's a combination of those two technologies that our patients benefit the most from.
Absolutely mind-blowing. 1 or 2 days, huh? That is fantastic. Dr. Pakal, we'll stay with you on this one. How has the partnership with MD Anderson enhanced the work that you both do and the cutting-edge technologies at your disposal?
Yeah, certainly it starts with funding, and the oncology umbrella within our network has been the benefit of that and allowing us to have the technologies that we do in the operating room. But in addition to that, we're able to enroll our patients in many cutting-edge clinical trials, and we have, as physicians, immediate peer-to-peer access to our colleagues at MD Anderson to discuss any challenging cases that might come our way. So we really are delivering the best care, data-driven care for our patients.
Dr. Gupta, I'll ask you the same question.
Yeah, kind of just to reiterate what Dr. Pakal has said, our partnership with MD Anderson has greatly enhanced just our field in terms of our communication with MD Anderson, just to be in the cutting edge technology and treatment for all types of lung cancers and thoracic malignancies in general. We're able to provide our patients with the utmost standard of care in a community hospital setting for our patients.
Yeah. Gentlemen, I don't have to tell you, but just for our viewers' sake, lung cancer remains one of the top cancers in Indiana. So how important is the screening process to ensure the best chance at successful treatment, especially among those in the minority populations? Dr. Gupta, you first.
Well, lung screening has greatly improved catching nodules prior to becoming larger or becoming metastatic. And especially among minority groups who are more prone to these things, I think lung screening with CT scans and what have you would greatly be able to allow us to treat these malignancies before they've gone too far, before they're uncurable, which is why it's just so important to undergo lung screening so this way we can catch these things at an early stage.
Dr. Pakal, I have about 30 seconds left. Take us home on that question, sir.
Yeah, I would just say that raising awareness for this disease is absolutely important. Curing lung cancer when it's early stage, it's easier to do. So from our standpoint, I certainly encourage any individuals who are either current smokers or former smokers to talk with their primary care physicians about obtaining a low-dose screening CT scan of their chest. That really allows us to identify any potential areas of concern in their lungs, and then kind of plug them in to whether it's thoracic surgery or pulmonary medicine. Get them to the right folks so they can take care of any potential lung cancers.
Dr. Pakal, Dr. Gupta, thank you so much for joining us, and we really appreciate all that you do, and keep up the fight. Thank you so much.
Thank you.
Thank you. Thank you for having us.
Coming up next on the show here, a cancer survivor discusses her journey and the support she got along the way.
You're watching Wish TV. We are local.
All right, welcome back to our Health Spotlight Special. I'm joined now by Sara Hauck, a young breast cancer survivor from Indianapolis. Sara, we were talking off camera. You have quite the story. Tell us a little bit about your journey with Community MD Anderson, and give us a little background, because I was just fascinated by the story you told me during the commercial break.
Yeah, well, I will try to keep it short, because it was a roller coaster, lots of ups, downs, and in-betweens. But with Community specifically, it was my OBGYN that I had for years, and when I found and felt the lump myself, that's where I went first. And my first visit with her really set the track for the rest of my time with Community, because she did not have an adverse reaction. She didn't kind of create tension in the room. She was very calm, cool, and collected. Sent me off to some, yes, yeah, okay. Yes, because I was very naive. I did not think anything of the lump. I really did not think cancer. And she was very calm, cool, and collected, sent me to the breast specialist. And then when they found out that I did have invasive ductal carcinoma, that was my diagnosis, she followed up like 2 weeks later with a note in my chart saying, "I wish you the best. You're in the best hands possible." And that was so above and beyond, you know?
You were so young. I mean, 30 years old.
Yes.
And you were when this happened. Cancer-free now?
Yes.
Okay.
Yes.
So take us through that part. I mean, for a couple of years now, you're dealing with this, the ups and downs.
Yeah.
Tell folks at home who maybe are wondering what that was like.
Yeah, it was a wild 2021. My husband and I had our rescheduled COVID wedding. We bought a home. We both turned 30. Right. I got a new job for the first time in 6 years. And then October, I was diagnosed with breast cancer. And the irony is just ridiculous. Yeah, and then it was determined I would have a bilateral mastectomy in January. That's when I became free of disease. And then I had 6 months of chemo and a month and a half of radiation. Rang the bell in October 2022, almost a year to the date later. And I've been free of it ever since. But as a lot of my friends in the cancer community know, it never really leaves you up here. So I was telling you earlier, I feel like I'm just coming out of the wave that comes after, and feeling a lot better, have a lot of my energy back. I'm not the same in and out, but it's the best and worst thing that ever happened to me.
Congratulations. Fantastic. How did the care team at Community MD Anderson impact your journey? Yeah,
the best way I can wrap it up is they made my life during a really hard time a little bit easier. And they did that in 3 ways. Human-to-human connection. Every single person I interacted with made me feel like a stellar patient. It was through the medical expertise, education, and just kind of guidance. I would ask doctors to spell things for me. I would have people repeat things, and nobody ever had 1 foot in, 1 foot out, you know? And then I would say physically, the environment. Community North is beautiful, and that matters. And I'll shout out the radiation space, because you're on that track on your back, laying there getting radiated, and you're looking up at stars. Yeah. It's a beautiful physical place to be, and if you can be in a really great environment with great people during one of the hardest times of your life, it makes it so much better.
What message, Sara, do you have to people out there about your journey and just about, everything you've gone through over the past couple of years?
Yeah, I have so many messages, but I guess I would say overall, you are responsible for you. And that's in every facet of your life. You're responsible for what you eat, what you consume, what products you use on your body and in your house. And that goes with, if you do get diagnosed with something like this is your journey. Ask the questions, make them spell things for you, ask for whatever comfort you need, and don't be afraid to stand up for yourself if you need to, and just remember that you are the patient, you are the driver in this seat, and if you're lucky enough to go to Community, they are supporting you the whole way in that.
Sara, thank you so much for joining us. Thank you for sharing your story. We are so happy that you are cancer-free. Thank you so much for being here.
Thank you so much.
Learn more and get more with Wish TV. Online at wishtv.com, and when you follow Wish TV on Facebook, be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.